Dengue is a serious infectious disease caused by a flavivirus which infects an Aedes mosquito. An infected Aedes mosquito will spread the virus through people via their bite. This mosquito also spreads Zika, chikungunya and other harmful viruses. Dengue are spread to more than 100 countries around the world. 40% of world population, which means 3 billion people, were infected with this virus. The virus that caused the dengue were called dengue. Dengue have 4 serotypes, which means den 1, den 2, den 3 and den 4, meaning that possibility people get infected 4 times is very higher. So this is the main character behind all of this. This is an Aedes mosquito. This mosquito are responsible to spread the virus to people. Their active hour is during sunrise and also sunset.
Hi and Assalamualaikum. My name is Nur Mashitah binti Ahmad Sa'ad. Eventually, there will be symptoms that will usually develop between 13 to 14 days after a person gets bitten by an infected mosquito. However, 80% of individuals that get infected by dengue virus does not show any symptom or can be called as asymptomatic. The common symptoms involve fever, headache, and pain behind the eyes, severe muscle and joint pains, extreme fatigue, and rash appearing between 2nd and 5th days of fever. Sometimes there are respiratory symptoms such as cough, nasal congestion, and sore throat. These symptoms usually last for 3 to 7 days, at which point the fever breaks. After the fever breaks, people either will start to get better or get much worse. According to the World Health Organization (WHO), any of the following symptoms like frequent vomiting, abdominal pain, mucus bleeding, and restlessness are the warning sign that will lead to the serious dengue fever, which known as dengue hemorrhagic fever (DHF). That's all from me. Thank you.
Hi, Assalamualaikum warahmatullahi wabarakatuh. My name is Zarit Sofia binti Zakaria, and today I'm going to explain the causes of dengue fever. Dengue fever is a disease that is caused by a family of virus transmitted by infected mosquitoes, which is known as Aedes aegypti and Aedes albopictus. The virus that is responsible for causing dengue is known as dengue virus or dengue. Dengue fever develops after a person is bitten by a mosquito that carry the virus. The mosquitoes obtain the virus by biting someone who is already infected by the virus and then transmit it to another person. For your information, dengue fever does not spread directly from human to human. This mosquito loves to breed in any container that hold water such as vases, buckets, old tire, and also flower pots.
Thank you, Zarit. Bismillahirrahmanirrahim. Assalamualaikum. Hi, my name is Haikal. Next, I will explain the impact of dengue. Up to 400 million of people get infected with dengue. Most of us does not even consider it as a big deal. But what if I told you that if you get infected with dengue, you will have a high risk to develop a long-term implication? The first one is anxiety and depression. Surprisingly, this is the one of the long-term side effects of dengue fever. Severe change in stress, anxiety, and depression were also seen in people who suffered from dengue fever. Another problem that may occur is dengue shock. It is a problem that happens when someone does not take good care once they experience a dengue fever. It will lead to hypertension, which can cause your blood pressure to spike higher than normal. If severe, it can cause fatigue, nausea, vomiting, confusion, anxiety, chest pain, and muscle tremors. The second one is joint and muscle pain. This happens when you are dealing with dengue fever and even after recovery. Chronic fatigue syndrome is also seen in many patients. Basically, it happens in most viral infection. We feel tired and always low of energy. Also, if you have diabetes, kidney or liver problem, the impacts of dengue fever can get more severe due to the weakened immune system.
Hi, my name is Nur Atisha binti Muhammad Roslan.
So, in my part, I will explain to you about the treatments of dengue. People with symptoms may be advised to treat the symptoms by consuming plenty of water to avoid dehydration due to over-vomiting. Next, taking paracetamol to reduce the fever and make sure to avoid medicine with aspirin which could worsen the bleeding. Lastly, people that diagnosed with dengue fever is advised to see a doctor and get the intravenous fluid injection, electrolytes replacement and transfusion of blood loss. Next, here are the few ways to prevent breeding of Aedes mosquitoes. First, get rid the habitat for mosquitoes to lay eggs by fogging them by the health authorities. Next, dispose solid waste properly. Make sure it does not provide habitat that can hold water for mosquitoes to breed. Third, cover the water storage and clean it weekly. Lastly, apply suitable insecticide in or tip out of any spot that hold water such as flower pot, trash cans and tires. Continue to the personal protection that can be practiced. First, keep house windows and doors closed during the day because the primary mosquito vector bite throughout the day. Second, wear less exposing and light clothes to reduce the chances of getting bite. Third, apply mosquito repellent at least 10% of diethyl toluamide or DEET. Lastly, use mosquito strap with insecticide. It is more effective than the non-insecticide. The mosquitoes will get killed directly. That's all from us. Thank you for watching.